Whenever we talk about the anatomy of any region, it is very important to understand the bony framework of that region. So it is important when we're talking about the ventral aspect of the wrist as well as the palmar aspect of the hand to understand the bony structures and the joints which are present in that region. And that would be the first topic that we are going to cover in this series. And in this section, we're going to talk about the bones of the hand as well as the bones of the wrist. We're also going to talk about the joints of the wrist and the joints of the fingers and the thumb. So let's take a look at the bones which are present in this region. So we are mostly concerned with the ventral aspect of the wrist and the palmar aspect of the hand, but as the bones remains the same in the dorsal and ventral aspect, so we are going to take a look at the different types of bones. So here we can see now this is the anterior view. When we talk about the anterior view, so in the anatomical position it is supposed to be the ventral aspect or the palmar aspect of the hand. So this one here is the anterior view or the ventral aspect, and this one is the dorsal aspect. So taking a look at this, we can see that here we have the major bones of the forearm, which one is the radius and the ulna. So radius is the major articulating partner at the level of the wrist. So this is the radius and this one is the ulna. After the radius and ulna, we have two rows of the carpal bones, and those carpal bones include trapezium, trapezoid, scaphoid, hamate, capitate, pisiform, triquetrum, and lunate. So these are actually two rows of four each, and the proximal row and the distal row of the carpal bones. And after the carpal bones, we have the five metacarpals. We have the first metacarpal, which is the metacarpal for the thumb, and then we have the first, second, third, and fourth and fifth. So second to fifth are for the first to fourth finger, or we can say the second to fifth digit. So first metacarpal is for the thumb and the second to fifth are for the fingers. So first finger or the second digit and index finger are the same thing. So if I say first finger, so that is the index finger, or if I say the second digit, that is also the index finger. So one another important difference is that when we talk about the metacarpals, after the metacarpals we have phalanges. So in the fingers we have three phalanges, which is proximal, middle, and distal, whereas when we talk about the thumb, we only have two phalanges, which is the proximal phalanx and the distal phalanx, and that is why we have only one or a single interphalangeal joint at the thumb, whereas when we talk about the fingers, we have proximal interphalangeal joint as well as distal interphalangeal joint. Talking about the carpo-metacarpal joint for the first digit or the thumb, it is the most mobile as compared to the other digits or the other fingers. And talking about the metacarpophalangeal joint, the metacarpophalangeal joint of the fingers are actually more mobile as compared to the metacarpophalangeal joint of the thumb. So let's take a look at the joints of the wrist and the hand after we have just taken an overlook at the fingers and the hand as well as the wrist bony structures. So when we talk about the joints of the wrist, so they are actually, if we talk about the wrist complex, so it is made up of three different joint complexes. So first of all, we have the if we talk about proximal to distal, so proximally, first of all, we have the radiocarpal joint. So it is called the radiocarpal joint because it is the articulation between the radius or the distal aspect of the radius with the proximal row of the carpal bones. Another very important thing to identify is that we haven't mentioned the name of the ulna in this joint, because ulna, it does not articulate directly with the proximal carpal row bones, and it is actually separated from the proximal carpal row via the articulating disc. So actually the structures which are in contact with each other in this joint is the radius, the articular disc, and the first row of the carpal bones, and that makes up the radiocarpal joint. Then between the proximal row and the distal row of the carpal bones, we have another joint which is known as the midcarpal joint. So this is the first row of the carpal bones and this one is the second row of the carpal bones, and they make a midcarpal joint between them. And after the midcarpal, we have the carpo-metacarpal, which is the joint between the carpal bones and the metacarpal bones. So the major movement is at the radiocarpal joint, but these plane joints, which are the midcarpal joints, actually there are some orthokinematic movements occurring between these joints, and they actually amplify and complement the overall movement of the radiocarpal joint. But major movement is at the level of the radiocarpal joint. So the movements possible at the radiocarpal joints or the wrist complex as a whole include the flexion and extension, as well as ulnar deviation and radial deviation, as you can see in this slide here. And these two movements in two different planes and around two different axes make this a 2 degree of freedom joint. So radiocarpal joint is a synovial joint, and that is why it is a freely movable joint, and it allows different types of movements, as we already mentioned, which is radial deviation, ulnar deviation, as well as flexion and extension. And because there are two different types of planes or two different types of axes around which movements are possible, so this is a 2 degree of freedom joint, and thus the circumduction movement is also possible at this joint, or you can say that circumduction is also possible at radiocarpal or the wrist joint. And according to the structure, it is actually a condyloid joint, and it is such a joint in which the concave distal end of the radius is the concave bony partner, or you can say the distal part of the radius is the concave bony partner, and the articulating disc articulates with the convex scaphoid lunate and trochletrium. So this proximal carpal row of the scaphoid lunate trochletrium, except for the pisiform does not participate directly in this joint. So scaphoid lunate and trochletrium, actually they behave as a single unit, and they behave as a convex bony partner, as you can see here. This is convex and this is concave. So if we talk about the movement, so it is actually the convex on concave rule which is being applied at this joint in terms of biomechanical movement concept. And as we said that it is a biaxial joint because the movement is possible in 2 degrees of freedom, including flexion, extension, radial deviation, and ulnar deviation. Moving on, we also have the midcarpal joint after the radiocarpal joint, which is between the proximal and the distal row of the carpal bones. So these are also known as midcarpal or the intercarpal joints, and it occurs between the two rows of the carpal bones, as we already mentioned. And as these bones have a different shape and they are irregularly shaped, and that is why they are classified as plane joints. So they are non-axial, they do not perform, or there is no such movement in terms of degrees of freedom which occurs at these joints. So they are termed as non-axial, but still nonetheless they have movements possible, and orthokinematically they complement and contribute towards the movement of the wrist by helping the radiocarpal movement. So they allow gliding movements, which are type of orthokinematic movements, and collectively contributing to radiocarpal joint motion, as I already mentioned. And then talking about the joints of the fingers and thumbs, as already mentioned, we start off with the carpo-metacarpal joints, and then the metacarpophalangeal joints, and the proximal and distal interphalangeal joints. But when we talk about the thumb and the fingers, there is slight difference between these. So we are going to talk about the joints of the thumb first, and then we're going to move on to the joints of the fingers. So talking about the joints of the thumb, we have three joints: the carpo-metacarpal joint, the metacarpophalangeal joint, and the interphalangeal joint. And as already previously mentioned, that there are only two phalanges in a thumb, so that is why it only has one interphalangeal joint as compared to two interphalangeal joints in the fingers. Moreover, carpo-metacarpal joint is made up of trapezium articulating with the base of the first metacarpal, because the thumb is recognized as the first digit and it is on the lateral aspect, and it is very mobile joint, and it is a type of a very unique joint structurally known as the saddle joint, because each of the articulating surface is convex in one orientation and concave in the other. So in one orientation the joint may follow the convex on concave rule biomechanically, but it may follow the concave on the convex rule biomechanically in another orientation of direction. So that is very important. And as it is a biaxial joint, we have two types of movement possible in two different planes, but there's also a slight component of rotation which is responsible for the movement of opposition between the little finger or the uh, fifth digit and the thumb, or also known as the first digit, and that is why it is known as a modified biaxial joint or a saddle joint. So it allows for flexion and extension, abduction and adduction, and opposition and reposition. So taking about the opposition and reposition into consideration, we would say that perhaps it is a 3 degree of freedom joint, but that is not so. It is a 2 degree of freedom joint. It allows flexion and extension, abduction and adduction. But rotation occurs orthokinematically with these movements, which may result in opposition and reposition, and that is why it is not known as a biaxial nor a triaxial. It is thus known as a modified biaxial joint. In anatomical position, the pad is perpendicular to the palm of the thumb, and the movements, as already mentioned, the possible movements are flexion and extension, abduction and adduction, and opposition and reposition. So moving on, in addition to carpal metacarpal joint, we have the metacarpophalangeal joint as well, and the interphalangeal joint as well. So as you already mentioned, the carpal metacarpal joint of the thumb is very mobile, especially as compared to the other fingers. But as compared to the fingers, the metacarpophalangeal joint and the interphalangeal joint are less mobile in the thumb. And the metacarpophalangeal joint here is a hinge joint that allows only flexion and extension, whereas in the fingers it also allows abduction and adduction. And therefore in the thumb it is only a uniaxial joint. Similarly, the interphalangeal joint in the thumb also only allows flexion and extension and is only a uniaxial joint. Now talking about the joints and motions of the fingers, so we have the second, third, fourth and fifth digit, also known as index finger, middle finger, ring finger and the little finger. And the each of the finger has four joints in opposition to the thumb, which only had three joints because it only had one interphalangeal joint. And the joints for the fingers are the carpal metacarpal, metacarpophalangeal, proximal interphalangeal, and distal interphalangeal joints. So starting off with the carpal metacarpophalangeal joint as opposed to the thumb, in which there was the saddle and modified biaxial joint, the carpal metacarpal joint of the fingers are classified as non-axial plane synovial joints that provide more stability than mobility. So at the level of carpal metacarpal joints, thumb is pretty much more mobile than the fingers. And the fifth carpal metacarpal joint, also known as the little finger, is most mobile in terms of the four fingers, even though it is much less mobile than the thumb. But in terms of the fingers, it is the most mobile, and small amount of finger opposition with the thumb is present because of this. And it does not allow as much opposition as the thumb, which is the first carpal metacarpal joint, which I already mentioned. That is a very mobile joint. And fourth carpal metacarpal joint is slightly mobile. Second and third are not. So when we talk about fifth, fourth, third and second, so fifth is most mobile, and as you move towards the second, their mobility decreases in terms of the carpal metacarpal joint. So metacarpophalangeal movement is actually initiated at the carpal metacarpal joint, so they actually facilitate the movement of the metacarpophalangeal joint orthokinematically. So talking about the metacarpophalangeal joint of the fingers, which is the most mobile joint in terms of the fingers, and it is more mobile than the metacarpophalangeal joint of the thumb. So they are biaxial condyloid joints as compared to the uniaxial hinge joint of the thumb, and they have rounded heads of the metacarpals which articulate with the base of the proximal phalanx, and these are also known as the knuckles. Now, talking about the metacarpophalangeal joints, the movement which are possible, as I already mentioned, that they have 2 degrees of freedom. So there's flexion, extension, abduction, and adduction, respectively. Now, talking about the abduction and adduction, it is very important to understand that in abduction and adduction, the reference point is taken as the middle finger. So if a finger moves towards the middle finger, then that is a double deduction, and if it moves away from the middle finger, then this is abduction or abduction, as we can see in this picture here as well. So as already mentioned, middle finger serves as the point of reference, and there are 2 interphalangeal joints in fingers, uniaxial, which are both uniaxial hinge joints and only allow for flexion and extension. So that was all about the bony framework and the joints and of the wrist and hand, and I hope you learned something new out of it. So keep watching sqadia.com for more lectures like this. Thank you very much.